Thank you so much for joining this afternoon on a rainy day. My name is Mehad, and I'll be your host for today's webinar, which is Taking the Bangladesh Health Sector into the Future. This webinar has been organized by LightCastle Partners and USAID AUHC, which stands for Advancing Universal Health Coverage in Bangladesh. And today's core objective of the session is to share insights and explore ways of attracting private capital and investments to facilitate innovation in Bangladesh's healthcare sector. So before I move into the panel discussion, I would like to welcome Dr. Fida. Dr. Fida to give the opening remarks. I'd like to give a quick introduction about him. He is a project development specialist of health systems strengthening at USAID. He has more than 15 years of experience in senior management roles in public health and wellness sector and over 10 years in international development programming in the field of health systems, services, and policies. So, Dr. Fida, over to you.
Thank you, Mr. Mehad, and welcome all to this webinar. And thank you to the AUHC team and the LightCastle team for organizing this webinar. And thank you to all the panelists as well, and the moderators who will be joining us today. We are looking forward to a great discussion today on the topic. In fact, if I may start, USAID, in fact, USAID is proud to have partnered with the government of Bangladesh for the past 50 years. And we have supported Bangladesh to drastically reduce child and maternal mortality, improve family planning access, improve nutritional status, reduce tuberculosis mortality, etc. So more recently, we have supported the Ministry of Health with a very robust COVID-19 response. I hope many of you know about that, including the US government donation of over 85 million vaccines, and many of which are being pushed into the arms of the people we love and know. We've addressed all the easy issues, basically, I would say. But now we have to work on the more challenging bits because we need to now build the health system and ensure that equitable access is given to and through affordable, high quality health services to the people. So over the years, USAID has supported the public sector to ensure quality healthcare for the people, as well as the non-government and the private sector. So you've heard about the Smiley Sun Clinic. That is one of the private sector initiatives that we have done, which used to be an
Fida bhai, you have become mute. Can you unmute yourself?
Sorry, when was I mute?
Just for 5 seconds. It's fine.
Sorry, I didn't notice. Anyway. Okay. So yeah, thank you. So so basically, USAID has been supporting the Smiling Sun Network, which is a private sector model, which used to be an NGO model back in the days since 90s. So that was donor funding supported, but now there is a social enterprise company. And we are proud to have the CEO of Surjer Hashi Network today with us. We'll obviously be participating in the panel discussions. So that has, they are now a company that, and they are moving forwards towards attracting diversified funding and partnerships so that they can become fully sustainable. So this is soon to be a success story on our side. Another successful venture that we have had from USAID is the social marketing company, which is a very known household name to many. So that started as a USAID family planning social marketing project in the 70s, but that now stands strong as a self-sufficient multi-million-dollar private company. And it still serves the poor with affordable quality commodities and preventive services. So that means that it's still possible to address development needs as well as do business at the same time. So Bangladesh, as you know, is progressing towards lower middle income country status, and USAID wants to support the national health system with sustainable solutions, using resources that exist in both the public and private sectors to improve the health and livelihoods of the people of Bangladesh. USAID wants to build bridges, connections, platforms, and networks to build the health sector and leverage resources from multiple sources. And that can reach people from all socioeconomic conditions with quality, affordable healthcare in all geographies of the country. USAID believes that there are many opportunities for private sector entities to play a role uh, in improving the health service access, quality, and affordability to result in financially and programmatically sustainable models. Some of these solutions could stimulate the private sector and job creation, and some could improve efficiency of public resources. We need to work together to identify the win-win public-private solutions that can achieve the overall objective of meeting the population's health needs. So USAID is working with the government to identify the policy barriers and surveying the private sector for initiatives capable of driving systemic change, informing new policies, and developing strategies to support improved availability of quality, affordable services and products. USAID wants to urge the private sector and also the primary healthcare network private sector entities to look for opportunities of potential investment, partnership, which I'm sure will be discussed at length today. USAID's focus is to ensure sustainable systems that can move to innovative and diversified financing models as donor funding begins to decline, which is inevitable, and that shift away from service delivery support from with the donor funding support. So we need to cover that through these innovative financing models, and I hope there will be a very productive discussion today on this topic. And we'd like to encourage the private sector and the healthcare startups to work together, to be involved, and create strong networks, engage with one another, and seek opportunities for funding and partnerships with healthcare and livelihood service providers so that we can create a sustained, lasting development outcome. Thank you for the opportunity to speak, and we're looking forward to a very productive webinar. Thank you.
Thank you so much, Fida Bhai, for giving the welcome remarks. That was very insightful. And আজকের ডিসকাশনটা আমরা মেইনলি তুলে ধরতে চাই আমাদের হেলথ কেয়ার সেক্টরটাকে কিভাবে আমরা আরো এগিয়ে নিয়ে যেতে পারি with the support of the development partners, the private sector, as well as the government collectively. So before we go to the panel discussion, I just want to give a quick keynote presentation to set up the floor. So I'd like to discuss about how we can mobilize investment for our national health agenda. And particularly, before we go there, we need to understand where does our health sector stand right now. So over the last 50 years, since our independence, our health sector has come forward a lot. From our life expectancy, it has increased from 52 years to 72 years over the last 50 years. 1990, from 1 lakh pregnant women, we have seen that 534 used to die, which has gone down to 273 by 2016. And we do understand that the government hospitals has increased to 600, and there is around 15,000 community clinics and satellite clinics. But then again, we can see that the GDP of the healthcare market against the country's GDP, against the country's expenditure, there's a big difference. Roughly 11% of the total country's GDP is spent on healthcare, whereas 5% of the national budget has been allocated for the healthcare sector, which is less than 1% GDP. But definitely we see that the Bangladesh healthcare market is growing rapidly. Back in 2017, it was roughly around 6.6%, and this can be over 10 billion by now, aggravated by COVID. So it's mainly because of the growing MAC population that has driven up the consumer appetite for it from all over the country. We also understand that the health insurance coverage is still less than 1%, so there is a huge opportunity over there, and roughly 72% of the total healthcare expenditure comes from the healthcare spend. So despite this, we do see that a lot of our money is also going outside, because a lot of people are going to India, Singapore, and Thailand and other places to take healthcare services, and that's accumulates to around 2.2 billion. So there are huge opportunities we see there. So clearly, we understand that donor funding has definitely played an instrumental role in the transformation of Bangladesh's healthcare sector. And it has helped to lift millions out of poverty. It has helped empower women and marginalized individuals, as well as facilitated the access of basic healthcare facilities. But we do see that there is a decline in terms of the fund. Roughly in 2000s, when the foreign aid was approximately 5% of the total GDP, now it has come down to roughly 2% of it. And as well as we also see that the category of foreign aid is also transitioning, whereas back in the 90s, there was roughly 20% for food aid, which also been accumulated for healthcare as well. That has rapidly shifted, and most of it goes into project aid. So this definitely signals the start of a development sector's evolution. So this is where we can actually introduce blended finance to bridge this financing gaps with the help of private sector. We do understand that if the public or the philanthropic resources can be used strategically, it can mobilize new private capital for development outcomes. And for countries like Bangladesh, which is a developing market, it will definitely help overcome a lot of multiple barriers to spearhead the healthcare sector. In Bangladesh, we do see that there are opportunities to bring in private capital in the form of new funding or in-kind investments from multiple sources, such as it can be private banks, impact investors, a lot of high net worth individuals who are interested in the healthcare sector. And we can also look into the pharmaceutical or the medical technology companies who are already playing in the market to invest here to help improve the value chain further. We do see that the traditional development finances, they were mainly provided in terms of grants or technical assistance, and they were solely provided to the implementer who are focused in diminishing the development outcomes. But that was solely dependent on one source of fund. So definitely when that fund runs out, so does the implementation sees a halt as well. But if we introduce blended finance and use the investments and the funding from the development partners to de-risk the implementation program, it can actually attract private financial institutions, and they can provide equity or debt instruments and help reach those development outcomes. So development finance definitely offers multiple benefits. The first one is it will definitely increase the funding towards development outcome. Right now, we have a huge deficit in terms of reaching the SDG goals by 2030, and definitely COVID has aggravated it further by diminishing the previous results that has been reached. So leveraging additional capital with the philanthropic and public funding will definitely help improve those opportunities. And there are a lot of other programs which also require some further investments and funding. So definitely grants and highly concessional capital can be utilized to de-risk and improve their financial return so that they can attract more private capital. Definitely, blended finance can be used to improve the sustainability. So if it is strategically deployed, blended finance definitely plays a transitional role by catalyzing investments that the private sector can scale and even replicate after the exit of the donor capital. It can also be used to stimulate innovation in projects which would require a return after a long time. So definitely that those kind of investments can be de-risked in the high impact sectors where normal market fundamentals might not function adequately. And it's definitely very important for Bangladesh because we have a huge unserved segment which requires a lot of services. So definitely those products and services can be innovated to reach them. And lastly, definitely blended finance can be used to develop the local capital markets. It can definitely help by de-risking entry into the market and definitely deepen the local financial market. And it can even introduce more innovative instruments that can be utilized by impact enterprises, startups, and SMEs. And definitely, if that opportunity arises, we can use that foreign capital to advance the growth and sophistications of the local businesses. So globally, we have seen that blended finance has been successful in terms of mobilizing private capital. Since 2012, in the last decade, since 2012 to 2020, we have seen that there is a 14% cumulative annual growth in mobilizing private capital from 15 billion to 45 billion. And roughly that has been mobilized 2/3 by the governments, development agencies, foundations, and other development financial institutions in impact sectors. So from the commercial investors, we see that there are multiple types of players involved, starting from commercial asset manager to financial institutions and other businesses and PVC firms as well. And definitely we see that healthcare is also emerging as a major area of capital deployment, where we have seen that the global health sector funding has grown up to 31 billion in 2021. And that was majorly because of the COVID pandemic and the chronic diseases that those are increasing. So the question is, we need to understand, where does Bangladesh stand in terms of promoting blended finance? So with comparison with other similar countries, we see that Bangladesh has an upper middle score in terms of measuring private market as well as health system status, but still it needs to be in the build stage, where definitely more innovative financing tools, vehicles, and instruments has to be introduced so that these blended finance instruments can be promoted and it can be widely accepted. So lastly, my recommendations would be to propel blended finance, some very simple ones. First of all, we need to improve the impact management and measurement to promote the transparency of blended finance projects, mainly because these practices are not well known by the private sectors. So once we publicize these tools, practices, and the knowledges, this will effectively increase their awareness and their attractiveness. Second, we also need to publicly advocate to mobilize private corporations in healthcare. So easily what we can do is we can bring in regulations to for the provisions of CSR funds that can be used as risk capital in impact innovation initiatives in the healthcare sector, as well as we can also implement tax return incentives for corporates to invest in blended finance structures. Thirdly, we must promote an investor-friendly ecosystem, because we need to reduce the flow of foreign capital in the country. So as soon as we make it more easy for it to come with less entry barriers and easing the repatriation of profits, we'll have more foreign capital interested in our local healthcare industry. Lastly, we can definitely provide incentives to healthcare startups. We see that over the last decade, $800 million of investments has been brought in, but roughly 30 million has been invested in health tech startups. So there are positions to bring in more capital. So definitely, if we incentivize them and help them improve their business performance as well as their attractiveness, further investments can actually propel into the sector. So thank you so much, everyone. That was from my side. And with that, we'd actually like to move into the panel discussion. The first one, which is the rise of startups and investments in the health sector of Bangladesh, which will be moderated by Tazin Bhai, who's a co-founder and CEO of AmarLab. And we have three key attractive panelists with us. We have Ms. Fahreen, who's the co-founder and CEO of DhakaCast, Mr. Hasan Arif, who's the head of investments portfolio of Startup Bangladesh, and we have Mr. Abdul Motenimon, who's the chief product officer of Praava Health. Tazin Bhai, do we have everyone here? Tazin Bhai, can you hear me?
Yep. All right.
Perfect. Fahreen, Hasan Bhai, Emon Bhai, can you guys also hear us? Maybe you can turn your camera on.
Yes, Bhai, we can hear you.
Hasan Bhai. Okay, I see everyone here. Great, thank you. Tazin Bhai, before I hand it over to you, I'll just quickly do an introduction of each of our panelists and the host for today. So I will just quickly start off with Hasan Bhai. So Hasan Bhai, he's the head of investments portfolio at Startup Bangladesh Limited, which is the $65 million VC fund backed by the Ministry of ICT. His career spans more than 20 years of work experience with expertise in private equity and investment management. And it also includes many senior management positions in financial services and technology management companies in USA. In his previous role, he has worked as a vice president for State Street Corporation, which is one of the largest asset management companies in the world, located in Boston, Massachusetts, USA. Hasan Bhai, thank you for joining us today. Next, I would like to go to Ms. Fahreen, who is the co-founder and CEO of DhakaCast, which is a healthcare startup in Bangladesh focused on supporting diabetic patients with home services, fully run by experienced and qualified doctors. The company also offers online and offline consultancy, regular health screening, medical delivery services, and cell-phone collection from home on-demand basis. Fahreen, thank you so much for joining today. Next, I will introduce Mr. Abdul Motenimon, who is the Chief Product Officer of Praava Health. This is bringing world-class healthcare in one of the fastest growing frontier markets, Bangladesh, and previously he has also founded a healthcare startup called Dr. Ola in 2015. Overall, he's an innovator, serial entrepreneur, and strategic management professional with more than 25 years of extensive experiences with multiple large corporations and startups. Emon Bhai, it's very nice to see you today. And lastly, before I hand it over to Tazin Bhai, I'll just quickly introduce him. So Tazin Bhai, he's the founder and CEO of AmarLab. He has over 15 years of experience in empathy-led technologies, services, and strategy deployment. He has over 10 years of experience in Microsoft USA, and he also brings in 12 years of experience in managing nonprofit organizations and developing innovative solutions to social issues based on strong field research and design thinking principles. Lastly, I would also like to add that he also serves as an advisor in ThinkWell's involvement in the AUHC program. Tazin Bhai, so nice to have you, and I will hand over the mic to you.
All right. Thank you, Mehad. Thank you, everyone, for joining. It's really good to have everyone here from different kind of sectors in healthcare. We have entrepreneurs, we have investors, we have nonprofit folks. So again, really great mix of people. So thank you, Mehad. Thank you, LightCastle and USAID and AUHC for organizing this. As Fida mentioned, over the years, USAID's involvement in health sector, and they are also moving from a donor-centric approach to more of an investment. And then we have seen a big rise of health entrepreneurship, and we have quite a few successful health entrepreneurs today. So with that, I think I'm really looking forward to have a great discussion. And again, like as Mehad mentioned earlier, feel free to speak in Bangla or English or mix it up, completely fine. And we have a couple of questions for each panelist, and then we'll also take some questions from the audience if we have time. I'll actually start with Emon Bhai first, because from an health entrepreneurship perspective, you have been one of the early ones. I remember in 2015, I was visiting Bangladesh and working for my nonprofit Spriha, and then a group of people came in and they're like, oh, we're from Doctoral and we're trying to see whether there are collaboration opportunities. So that was the first time I heard about it, but it was way before anyone has thought of like disrupting healthcare from a startup or entrepreneurship perspective. So I would like to know about your experience, how you got started, what made you think of that, and how over the years the ecosystem and the healthcare industry has evolved. Thank you.
Thank you so much, Tazin Bhai, and thank you, LightCastle USAID, for this opportunity. Yeah, Tazin Bhai, to absolutely just to move to the right direction as per your question. Actually, when I started Doctoral back in 2015, yes, you were right. At that time, it was difficult to actually imagine or difficult to plan something like a marketplace for healthcare services, because I understand that in a startup model, in regards to healthcare, there can be three. To my understanding, this is again, someone may have different perspective, different point of view, but I understand that there can be three kind of value creating startups or initiatives. One is a marketplace or an aggregator, which actually brings in all the other services and make the delivery of that services convenient and access to those services convenient for the people. So that is one way to look at these sort of initiatives and categorize these sort of initiatives. And another is becoming directly a provider and improvising and innovating on the quality of service delivery, quality of services itself, and bundling things in a way that makes more sense for people as a value for money, what they get. And third kind is purely technological innovation, that is improving healthcare itself, improving healthcare delivery, execution, and management of the services improvement. So when I started off with the idea for Doctoral, actually, unlike many other entrepreneurs, I didn't really have a personal connection to the urge or to the need. Rather, I was looking at finding an opportunity. I have always wanted to do something on my own. So, and I had my businesses earlier as well. So I wanted to do something which has got a potential to create an impact, as well as the potential to become really big. So these were the two elements that came into my mind. And when the impact thing, when I was considering the impact thing, I was brainstorming that what are the areas people are really in problem in the country. And obviously, we all know that that list will obviously include healthcare, will obviously include education, will obviously include job. So these were the areas I thought requires priority. And from these, after few discussions among the internal team members and others, we eventually focused down to Doctoral. So the journey was, the starting journey was more based on analytics, more based on certain kind of research, if not too deep. It was based on certain intent. So it was quite intentional and planned. So it was not just driven from any particular urge or urgency just that I faced initially. So I always thought that I was placing Doctoral in this marketplace bucket, and I was thought there are many areas to improve. There are many areas that requires improvement and contribution from innovators, from entrepreneurs across the country in the healthcare ecosystem. But obviously, one can really target, or one shouldn't be targeting to contribute in all the aspects of healthcare ecosystem improvement. So from that point of view, I chose that with the management knowledge I have, with the process knowledge I have, and with the technology resources we had, it made more sense for me to focus on building a marketplace, so creating access to healthcare easier or better. Before Dr. Ola, it was very difficult to imagine for most of the people that even for the doctors themselves, the respected doctors themselves, to route an appointment seeking or finding a particular doctor or getting to know that which particular specialist I need to consult. When I say which particular specialist, it's not a particular person, it's a category of doctors. So which specialist to consult based on my problems I have. There, existence of any third party dealing with solving these problems before one reaches a hospital, front desk of a hospital, or front desk of a healthcare provider directly, having a third party in between was quite difficult to imagine at that point of time. And it was really difficult for me to convince, to get the buy-ins from the doctors, from the hospitals, to get onboarded on a third-party platform for allowing them to manage their appointments, allowing them to make introductions for them to the patients whoever needed that service, whoever needed that treatment. So having a database containing information about the fees, about the different specialties, super specialties, and even many times, say for a lot of nephrology doctors, I had to specifically maintain information that whether that particular kidney doctor deals with child nephrology problems for pediatric patients. So these sort of details, availability of these sort of details, keeping this data available and compiling all this data, keeping that available for people was really a challenging thing to imagine. So that was more of a starting for bringing it in live. Had to focus on building a good system which could enable the organization to fit in and keep all the information and data in a place in a way that makes best use of those information in terms of creating better accessibility, creating convenience for the people. So there were a lot of other avenues, and eventually the journey went on. So that was more or less about the history, how Dr. Ola came into being. Yeah. Thank you, Tazin.
Quick follow-up question to that, like
Please.
How do you think the healthcare ecosystem and the industry
has grown? Sorry, I missed that part of the question. Sorry. Yeah, healthcare industry and ecosystem, especially in respect to not in respect to traditional healthcare systems. I'll put more light on the healthcare startups. So in terms of healthcare startups, we see a lot of changes, obviously, to my understanding. The 3 areas I mentioned earlier, especially in the marketplace area, in the aggregator area, there are a lot of different players now are in the country, in the market. And many of them has come up with the offers, come up with convenience and different other values for people, like say, if I take AmarLab as an example. So just AmarLab, just dealing with diagnostic services, just becoming a marketplace for diagnostic services. This itself can be a big milestone for the whole ecosystem, because today maybe we are adapting to the existing practices. At that time, these startups will start gaining more and more control. And the limitations we have, we all know that we have a lot of limitations, we have a lot of challenges in the healthcare system itself. So solving those challenges, addressing those problems will become easier for these innovators. So in that respect, it's very encouraging. I see a lot of new startups coming in, and many of them are doing fantastic. So I would say, in terms of progression, the progression is clearly there. But obviously, in the other 2 segments, that is improving the healthcare service delivery itself, like coming up with technology, artificial intelligence-based technology, or IoT-based technologies, or different other technologies we can talk about. So technology-based solutions to make the healthcare delivery itself better I think we haven't progressed much there. So there are a lot of scope to focus on those areas as well. So in summary, I see there are a lot of opportunities, and I see the progresses we have made in a particular type of startups is quite encouraging.
Thank you so much, Emon bhai. And I couldn't agree more that the opportunity in healthcare is tremendous from all sort of perspectives. We're just at the very early stage. Lots of places to go, not just like AI, IoT, you mentioned technology, but even in terms of healthcare delivery. One of the things I really like what you mentioned is the combination of impact and scale. And that I think would be a key, because if we have something impactful that doesn't scale, will not help for a country like ours where population is a big challenge. And talking about, you mentioned a lot of new startups coming up. So from that perspective, I'll go next to Dr. Fahreen, who is the founder of DhakaCast. And DhakaCast focuses solely on diabetic patients in Bangladesh. And they have been one of the few healthcare startup that has been funded by Startup Bangladesh, which is government's VC fund. So from that perspective, Dr. Fahreen, my first question to you would be what made you focus on diabetic patients only instead of general healthcare services, which is something that a lot of people go towards? And also are you who are your target clients or target population right now? Are you also working with disadvantaged or underserved communities or not? Thank you.
Thank you, Tazin bhai. Thanks for having me. Hello, everyone. আচ্ছা আমি একটু শুরু করি কেন ডায়াবেটিস এন্ড কেন ঢাকা কাস্ট। তো বেসিক্যালি আমি নিজে একজন ডক্টর, সো আই লেফট মাই 9 years চেম্বার প্র্যাকটিস ফর বিল্ডিং আ নিউ থিং। অ্যাকচুয়ালি নিউ থিং না, যে জিনিসটা আমাদের অলরেডি আছে, যে একটা সার্ভিস দেয়া, সো সেটাকে একটু শেপ আপ করতে চেয়েছিলাম থ্রু পডকাস্ট। তো যে সময় আমি শুরু করি 2019, সো ওই সময় বাংলাদেশে পডকাস্টিংটা এত পপুলার ছিল না এই মুহূর্তে যতটুকু আছে। তো আমার খুব শখ ছিল যে বাংলাদেশে যে সব ডক্টররা আছেন দে আর সো ট্যালেন্টেড এবং তারা খুবই ব্যস্ত থাকেন, তো তাদের যে লিগ্যাসিটা তারা রেখে যেতে পারে থ্রু পডকাস্ট, এবং সেখান থেকে একটা বিজনেস রান করার একটা চিন্তা ভাবনা ছিল। ইম্প্যাক্ট তো ডেফিনেটলি একটা বড় ফ্যাক্টর। বাট যখন আমি দেখলাম যে না, পডকাস্টিংটা ঠিক আসলে এই মুহূর্তে 2019-এর কথা বলছি, যখন আমি শুরু করি, যে পডকাস্টিংটা আসলে ওই মুহূর্তে খুব একটা, আমি হয়তো মার্কেটটা আমাকে ক্রিয়েট করতে হবে ফর হেলথ কেয়ার সেক্টর। তা আমার খুব ইচ্ছাই ছিল যে আমি হেলথ কেয়ার সেক্টর নিয়ে কাজ করবো। অ্যান্ড ওয়াই ডায়াবেটিস ওই কোয়েশ্চেনটা আসছে যে কাজ করবো, এবং এখানে ডেফিনেটলি দুইটা জিনিস আমার মাথায় তখন কাজ করছিল যখন আমি ঢাকা ক্যাস্টে পডকাস্টিং থেকে একটু সরে আসলাম, যে না আমি এখন পডকাস্টিংটা করবো না, আর হয়তো কিছুদিন পর, কিন্তু আমি এখানেই থাকবো এবং আমি একটা ইম্প্যাক্ট ক্রিয়েট করা যায় এমন কিছু নিয়ে কাজ করবো। আমি তখন মার্কেট রিসার্চ করি, অ্যান্ড আই ফাউন্ড দ্যাট diabetes is a disease which is called the mother of all disease. It can affect heart, kidney, lungs, skin, every organ of human body. And ওটা একটা ছিল যে যেহেতু ডায়াবেটিস এমন একটা রোগ যেখানে 13.1 million people are affected by type 2 diabetes in Bangladesh right now, সো ওখানে একটা কাজ করার বড় সুযোগ আছে। এবং আমরা দেখি যে একটা হেলথ স্ক্রিনিং রেগুলার ফলো আপ কিন্তু ডায়াবেটিক পেশেন্টদের লাগে। নর্মালি কি হয়, নর্মালি আমরা যদি হার্টের কথা বলি, আমরা যদি দাঁতের কথা বলি, যেমন আমি নিজে আমার বেসিক ডেন্টিস্ট্রি, সো ওখান থেকে আমি এসেছি, তো আমরা যদি কোনো একটা স্পেসিফিক অর্গানের কথা বলি, সেটা চিকিৎসা করলে কিন্তু সেটা ভালো হয়ে যায়, রাইট? বাট ডায়াবেটিসকে কিন্তু একদম বলা হয় যে লার্ন টু লিভ উইথ ইট। সো ওইখানে রেভিনিউর একটা ব্যাপার আছে যেখানে আমি স্কেল আপ করতে পারবো। অ্যান্ড এটা আমার মাথায় ছিল বিজনেস পার্সপেক্টিভ থেকে। এছাড়াও যেটা সবচেয়ে বড় পয়েন্ট, সেটা হচ্ছে যে টু ক্রিয়েট আ গুড ইম্প্যাক্ট। একটা ডায়াবেটিক পেশেন্ট যখন ফ্যামিলিতে থাকেন, তার যখন শরীরটা ভালো থাকে না, তখন কিন্তু পুরো ফ্যামিলিকে ইফেক্ট করে। এবং 13.1 million ইজ আ বিগ নাম্বার। 2045 এর দিকে আমাদের হয়তো এটা ডাবল হয়ে যেতে পারে এই নাম্বারটা। সো ইটস ভেরি অ্যালার্মিং। তো এইখান থেকে আসলে আমি কাজটা করা শুরু করি, এবং তখন 2019 এর কথা যদি বলি, তখন এত কিছু বুঝতাম না আসলে যে নিশ বেসড কাজ করছি বা কিছু। তখন একটা প্যাশন থেকে শুরু করি, এবং আমি আমার হাজবেন্ড আমরা দুজনেই ঢাকাকাস্টকে ফাউন্ড করি, এবং আমরা ওখান থেকেই পথ চলাটা শুরু করি। ধীরে ধীরে ছোট ছোট পিভটিং হয়, বাট আমাদের মেইন ফোকাস থাকে ওটাই যে ডায়াবেটিক পেশেন্টদেরকে আমরা একটা ওয়েল কন্ট্রোল ডায়াবেটিক লাইফ আমরা তাদেরকে দিব, যেহেতু এটা পুরোপুরি রিমুভ করা সম্ভব না। এবং আমরা দেখেছি যে ঢাকা সিটিতেই কি পরিমাণ ডায়াবেটিক পেশেন্ট এই মুহূর্তে আছে। আমরা যদি সেটাকে নাম্বারে বলতে চাই, তাহলে সেটা প্রায় 20 লক্ষর মতো। তো এত ডায়াবেটিক পেশেন্ট, তারপর তাদের শুধুমাত্র যে কনসালটেন্সি লাগে, টেলিমেডিসিন সার্ভিস লাগে তা না, তাদের প্রোডাক্ট লাগে এভরি মান্থে। তাদের টাইপ 2 যেটা নিয়ে আমরা কাজ করছি এই মুহূর্তে, প্রত্যেক মাসে তাদের ডায়াবেটিক রিলেটেড প্রোডাক্ট লাগে, ইকুইপমেন্টস লাগে। এছাড়াও দেখা যায় যে ডায়াবেটিক, যেটা আমি শুরুতে বললাম যে মাদার অফ অল ডিজিজ, সো এইখান থেকে যে কোনো অর্গানকে কিন্তু ইফেক্ট করে। সো সেইখানে আমাদের কিন্তু কাজ করার বহু সুযোগ আছে। এবং আমরা এখন মাত্র শুরু করেছি টাইপ 2 ডায়াবেটিস নিয়ে, যেটা 13.1 মিলিয়ন পিপল রাইট নাও ইন বাংলাদেশ। বাট আমাদের ফিউচার টার্গেট হচ্ছে জেস্টেশনাল ডায়াবেটিস নিয়ে কাজ করা, টাইপ 1 ডায়াবেটিস নিয়ে কাজ করা, যেগুলো নিয়ে কাজ আসলে খুবই কম হচ্ছে এই মুহূর্তে। আমরা যদি পাশের দেশে তাকাই, ইন্ডিয়াতে, তাহলে অলরেডি দেয়ার আর 65 ডায়াবেটিক স্টার্টআপ আর দেয়ার। হ্যাঁ, তো সেখানে বাংলাদেশে আমি মাত্র একা কাজ করে যাচ্ছি। সো নিশ বেসড হওয়ার রিজন এইগুলি তো ছিলই, এবং এর পাশাপাশি আমার কাছে মনে হয়েছে যে আমি যদি স্পেসিফিক একটা গোল নিয়ে আগাই এবং ওখানেই যদি আমি লিড করতে পারি, তাহলে সেখানে মানুষের ট্রাস্টটা যেমন আমি পাবো, সেই সাথে আমরা কিন্তু মেন্টাল হেলথ নিয়ে অনেক কথা বলি, রাইট? আমরা বাচ্চাদের ডিজিজ নিয়ে কথা বলি, আমরা আমাদের নারীদের স্বাস্থ্য নিয়ে কথা বলি। আমরা কিন্তু ফ্যামিলি যে যাকে আমরা সবচেয়ে বেশি ভালোবাসি, যে এল্ডার মেম্বারটা রয়েছেন, তার কথা কিন্তু বলি, বাট কোথায় গিয়ে ঠিক কেয়ারটা করতে হবে এটা আমরা ঠিক বুঝতে পারি না। সো ডায়াবেটিস থেকে আমরা শুরু করেছি, বাট আমাদের আরো সামনে আরো উইং আসবে, লাইক ফিজিওথেরাপি সার্ভিস, তারপর হচ্ছে নার্স এন্ড কেয়ার গিভার সার্ভিস, যেটা অলরেডি আমরা ডায়াবেটিক পেশেন্টকে দিই, বাট এটাকে আরো বড় পরিসরে আমরা হয়তো আনবো। জেরিয়াটিক পেশেন্টদের জন্য আমরা সার্ভিসটা দিব। তো সেইখানে ডায়াবেটিস আসলে অনেকটুকুই রোল প্লে করে। তো এইটা ছিল একদম নিশ বেসড কাজ করার রিজন। অ্যান্ড আরবান পপুলেশনের জন্য আমাদের আসলে প্রথম প্ল্যানটাই ছিল আরবান পপুলেশনের জন্য, বিকজ যখন মানে অ্যাজ আ ডক্টর আমরা দেখলাম যে আমাদের ফ্যামিলিতেই যখন ডক্টর আছেন, কিন্তু তারপরেও ডায়াবেটিক পেশেন্টরা আছেন এবং দে আর নট সো মাচ অ্যাওয়ার অ্যাবাউট দ্যাট ডিজিজ, তাহলে বাকিদের কি অবস্থা? হ্যাঁ, ঢাকা শহরে বাকিদের কি অবস্থা? আবার ঢাকা শহরে যদি এত সচেতন হয়েও আমরা ঢাকায় সব সুযোগ সুবিধা পাই, এত সুযোগ সুবিধা পাওয়ার পরেও যদি এই অবস্থা হয় যে এতগুলি লোক ডায়াবেটিক, হ্যাঁ, কিন্তু তাহলে আরবানের অবস্থা কি? তা আমরা কিন্তু কাজ শুরু করেছি, আমরা কিন্তু থেমে নাই। আমরা গত বছর প্রথম 2020 ডিসেম্বর না, 2021 শুরুতেই আমরা প্রথম সিলেটে একটা উপজেলা আছে বিশ্বনাথ নামে, সেখানে আমরা একটা পাইলট প্রজেক্ট শুরু করি। এবং খুব চমৎকার লেগেছে যে সেখানকার মানুষকে আমরা সার্ভিস গুলো দিতে পারছি, এবং এখনো সার্ভিস যাচ্ছে অ্যালং উইথ অ্যানাদার ক্লিনিক, নিউ লাইফ মেডিকেল সার্ভিসের সাথে আমরা পার্টনারশিপ করে ডায়াবেটিসের পার্টটা আমরা দেখছি। এবং তারপর ধীরে ধীরে অলরেডি আমরা কিন্তু 5টা রুরাল সাপোর্ট সেট আপ দিয়ে ফেলেছি। তার মধ্যে মানিকগঞ্জ আছে, তার মধ্যে বান্দরবনের লামা আছে, চুয়াডাঙ্গা আছে, মেহেরপুর আছে, হ্যাঁ, তো এই সাতক্ষীরা আছে। এরকম করে আমরা 5টা সেট আপ কিন্তু দিয়েছি, এবং আমরা টার্গেটই করেছি এমন সব এরিয়াতে যেখানে কিনা হেলথ কেয়ার সার্ভিস থাকলেও, প্রাইমারি হেলথ কেয়ার সার্ভিসটা থাকলেও সেইখানে হয়তো ডায়াবেটিস নিয়ে এত বেশি সচেতনতা নেই। এছাড়াও আমরা আরেকটা যেটা করেছি সেটা হচ্ছে যে বাংলাদেশের সবচেয়ে লার্জেস্ট টেলিকম আছে গ্রামীণ ফোন, তাদের সাথে আমাদের একটা পার্টনারশিপ হয়েছে। আপনারা যদি মাই জিপি অ্যাপে যান, তাহলে সেখানে ঢাকাকাস্টের সার্ভিস পাবেন। সেখানে আমরা চেষ্টা করছি যে তাদের যেহেতু প্রতিদিন প্রায় 10 মিলিয়নের মতো তাদের লগ ইন হয় এবং তারা দেখে, লোকজন দেখে, তো সেইখানে যদি আমাদের সার্ভিসটার মাধ্যমে যদি আমরা আরবান পপুলেশনের জন্য পৌঁছাতে পারি। এবং আমরা দেখেছি যে ডায়াবেটিক পেশেন্টদেরকে খরচ করতে হয়, মানে একজন সুস্থ মানুষকে প্রতি বছরে খরচ করতে হয় $100। আমি বা আমাদের মতো যারা আছে, একজন ডায়াবেটিক পেশেন্টকে খরচ করতে হয় তার 6 টাইমস, মানে $635 পার ইয়ার। সো সেইখানে আমরা খরচটাকে কমিয়ে আনতে চেষ্টা করছি এইভাবে যে একটা ডায়াবেটিক পেশেন্টকে 6 বার ভিজিট করতে হয় তখন যার ডায়াবেটিস ধরা পড়ে। বিভিন্ন কারণে টেস্ট করতে হতে পারে, রিপোর্ট নিয়ে ডাক্তারের কাছে যেতে হতে পারে, ফলো আপে যেতে হতে পারে। তো সেটাকে আমরা যদি কমিয়ে 1বার বা 2বারে নিয়ে আসতে পারি, তাহলে কিন্তু তার দেখেন কিভাবে কস্টটা কমে। একটা হচ্ছে ট্রান্সপোর্টেশন কস্ট কমে যাচ্ছে, আরেকটা হচ্ছে সে যে ডক্টরের কাছে গিয়ে ঘন্টার পর ঘন্টা অপেক্ষা করছে, এটা আসলে কোনো ডক্টরের দোষ না বা কোনো ফল্ট না, এটা হচ্ছে যে আমাদের দেখা গেছে যে যারা বিজি প্র্যাকটিশনার মানে সংখ্যায় তারা অনেক কম আছেন। তো সেইখানেও কিন্তু আমরা যখন অনলাইনের মাধ্যমে সার্ভিসটা দিচ্ছি তখন কিন্তু তার প্রোডাক্টিভ টাইমটাকেও আমরা অনেক বেশি এটাকে টাইম সেভিং বলতে পারছি। তো সেখানেই আসলে আমরা কাজ করছি, এবং আরবান পপুলেশন আসলে আমাদের যারা বিজি প্র্যাকটিশনার আছেন বা এক্সপার্ট আছেন তারা সবসময় যেতে পারেন না বিভিন্ন কারণে। সো টেলিমেডের মাধ্যমে কিন্তু রেগুলার ফলো আপ এন্ড হেলথ স্ক্রিনিং পসিবল। সো এই দুইটা রিজন নিয়ে আসলে ডায়াবেটিস নিয়ে কাজ করা, এবং আমাদের প্ল্যান হচ্ছে আগামী 5 বছরে শুধু আরবান পপুলেশন বা ঢাকা সিটির জন্য ডায়াবেটিসটা না, আরো যে দুইটা টাইপ আছে সেই টাইপগুলির জন্য আসলে বেটার কিছু সার্ভিস নিয়ে আসা, যেটা আমরা এখন টাইপের জন্য করছি। থ্যাংক ইউ।
Thank you so much, Dr. Fahreen. And as you said, diabetes, you just live with diabetes. So, যদিও এটা niche বলা হচ্ছে, আসলে সেই অর্থে আসলে niche নাই, যে কারণে 20 lakh people in Dhaka, for example, it's অন্য একটা কান্ট্রির জন্য কিন্তু এটা probably একটা half the population of a city এখানে। হ্যাঁ, so সেই জন্য আমার কাছে মনে হচ্ছে very timely initiative. As someone আমার family তে have both on mother side, father side diabetic patients যারা 30 বছর 40 বছর ধরে diabetes নিয়ে আছেন আর কি, and what you mentioned product and medicine and regular checkups, so lots of different things. So সেই জায়গাতে obviously it's having an impact, যেটা আবার ইমন ভাই যে কথাটা বলেছেন, impact and scale, and both are possible here. So since you have been kind of funded by Startup Bangladesh, so to a segue, I'll actually my next question is actually to Hasan bhai from Startup Bangladesh. So I would like to know, Hasan bhai, Startup Bangladesh has been very active in the past year, already invested 4 million in 15 companies, including startups like Moner Bondhu and DhakaCast. এইসব ইয়ে থেকে, তো সেই পার্সপেক্টিভ থেকে what I want to know is what are some of the key things that a health tech startup needs to keep in mind when they're raising fund from Startup Bangladesh, because it is unique, it is funded by Bangladesh government, also it is a VC. So Hasan bhai, if you can share a little bit.
Sure, thank you for Tazin for the opportunity, and it's a great question. I guess you guys can hear me, right?
Yeah, we can hear you. Thank you.
Okay. So I mean, there's a few things. One is so Startup Bangladesh. When we invest, I mean, we are very happy that we invest in DhakaCast, Manibandhu healthcare side. When we look into investment, there are certain things we look at, right? Some are in general terms is agnostic to the startup. We want to make sure that we are supporting the tech-based innovation, which helps the economic development, right? Our Startup Bangladesh is strategic initiative by government of Bangladesh. So we want to make sure that our investment, we do the investment in such a way that impacts the broader population, right? And healthcare is very important in that matter. The startup that we look into, it should generate new employment, and it should develop technical skills in targeted area, right? And promote and serve under representative population, right? Like DhakaCast helping out with that, serving the underrepresented rather population. And also we want to make sure that when we're investing, the founder and the team is a strong team, right? All-rounded team. And we usually would like to see that the startup is not dependent on a single stakeholder. And again, this is like it is applicable to all startups. But for healthcare startups, I mean, in Bangladesh, there are a lot of opportunities in the healthcare sector. Like Emon was explaining, all the opportunities as a service provider, aggregator, technology, innovation, etc. Right? And Tazin bhai, you are doing something very specific, service lab diagnostic, and Dr. Fahreen is providing specific to diabetic services. So I mean, it has to be something innovative, something tech-based, right? You cannot just open up a startup with providing telemedicine service and say, okay, I'm gonna run with that. So it should be specific. It should be, there's a lot of opportunities in city areas, a lot of opportunities in rural areas. A startup wants to decide where they want to provide the services and what sector, what type, what a specific niche they want to address, right? And you can try to be something like Praava, or you can try to be something like very specific AmarLab, etc. But it has to have some innovation, so something that it brings efficiency in the system from the quality perspective, some pricing perspective. But the scalability is one thing, obviously, we all know that scalable. It has to be scalable. And hopefully, your innovation, you should be able to replicate even beyond Bangladesh, right? So that you can get better opportunities just beyond Bangladesh. And another thing is technology. Emon was also mentioning the technological development is important, right? He was saying that that's where some focus needs to be there from the startup perspective and others. And so, like AI-based solution, right? That is important in order to provide services, end-to-end services. And a startup in the healthcare sector doesn't have to be only providing the health services. Like it could be part of the whole value chain. Like you can, like I've seen in other countries, like you can bring some efficiency in the billing processing system, right? Or in administrative, like you make an appointment, or in the whole supply chain, you can bring some niche services and make it better, faster, cheaper, then you should be able to succeed. So it doesn't have to be that, okay, you have to provide health services. There's a many opportunities in the healthcare sector in Bangladesh, because again, there's a lot of opportunities in healthcare. You have to look into, say, okay, what is the heart problem? What is the issue and how we can resolve the issue, right? And another thing is that it has to be, you have to be able to build a platform, right? In order to have some kind of interoperability among other stakeholders, like to connect with the hospitals or doctors or labs. If the interoperability is there, then that's a great opportunity for a startup. So there are different opportunities there, different way to get the part of the action in a startup in Bangladesh, because again, there are a lot of opportunities in healthcare in Bangladesh. And when we look into the startups, we want to make sure that the startups is compliant with all regulatory issues, because we want to make sure that you are compliant, and that is very important for a startup to do business and also for us to invest in a startup, right? So in our case also, we look into impact, what kind of impact is making to the population. Like SDG impact is one of them, like what are the SDG impact is doing. So there are the various things we look at, and obviously the founder and the team and etc., as I mentioned, and what kind of growth opportunity they have, what are the exit plan, the path they have. So those are the things we look at in a startup to make sure that they will be viable, they'll be scalable, and they are solving a problem in the healthcare sector. So that's how we look at in a nutshell.
Thank you so much, Hasan. There's so much information, great information. I hope startup founders who are joining today will take note, because I think there are lots of good things that you mentioned. One thing I really like, you mentioned that healthcare service, like, in order to get funding from startup, it does not have to be like providing healthcare itself. There are lots of things within healthcare. And many times when we talk to patients, we see that a lot of their kind of dissatisfaction comes from not just the doctor or the healthcare part, but other things, like you mentioned billing, for example, and lots of other areas, like, how a service is designed from entering a hospital to getting out. So lots of areas to think about. And another thing I really like that you mentioned like, it has to be scalable, not just in Bangladesh, beyond Bangladesh. And then why not? Why would a service. If Skype started in Estonia and coming to Bangladesh, why cannot we do the same and then do something similar where our services go beyond that? So thank you again. And I would like to actually ask you a follow-up, because since Startup Bangladesh is kind of like in a unique situation. It is an investment body, it is a VC, but at the same time, it is tied to the government, and you have something that you can offer more than just investments. So from that perspective, can Startup Bangladesh help health tech startups with help regarding policy advocacy and other things to kind of drive the ecosystem? Because healthcare, which is kind of compared to the other sectors, is more regulated, lots of policies around it, and for good reason. So can Startup Bangladesh play a role over there?
Yeah, absolutely. So Startup Bangladesh, as you mentioned, it's not just making investment like a typical VC firm, right? We support the startup ecosystem. We want to we want to help all the startups, the healthcare and others, right? And our services and our mission is to support them in different areas, to help them with connecting the VC and et cetera, mentoring. But beyond that, as a government agency, we also try to help with the policy side. Like if there is any policy, there's a gray area there. There's something new, innovative is done, but there's no regulation or policy yet has been built out, right? Because the policy and laws always follows behind the technology, right? Technology comes and people say, okay, we need to figure out how to regulate or manage it, right? So that's why we can definitely play a role, and we have been doing it. Like I would give you an example from the edtech startup. We provided a lot of services. They work with different, they work with education ministry to provide services. Same thing we have done for some of our startup portfolio in the healthcare to connect with regulatory bodies. So we can play a role. I mean, once we find out what are the challenges the startup facing, we work with them, and we will work with them to work with the applicable regulatory bodies and how we can formulate a new policy or tweak existing policy so that they don't face any regulatory issues, right? So that's definitely our role, and we are always open to it. And once we find out, we work with them. And also from the technology perspective, one thing we are looking into is to help support some sort of platform, right? Like for example, a startup cannot build a huge platform like medical record tracking platform, right? When for Tazin Bhai, as you would do a lot of diagnostic testing and everything, you keep the record, right? And you want to make it available to the different hospital and doctor's office and everything like that. But there are a lot of services that platform oriented, depends on the platform. And a startup may not have enough money, will not have enough money to build a huge platform. So if we can build a platform for the health sector, depending on what the need is, and all the startups, they can connect to the platform through API process or any other process, right? They can use the platform. In that case, their cost of technology will go down, and government will build the platform. Yeah, it is similar to some of you who you may know that the IDTP, the fintech platform that Bangladesh government is building, Bangladesh Bank is building, right, and implementing. The similar kind of thing we are looking to how we can build a platform that healthcare startup can leverage instead of building their own platform. Every startup they don't have to duplicate the same platform for their own services, right? So that's where we are trying to help also, in addition to the policies and technology side, we are also looking into those things.
Excellent.
I hope that answers your question.
No, thank you so much. This is exactly like lots of actually avenues for startups to work with Startup Bangladesh and actually ask for help. First of all, I think like that's very important that they should go and ask for help, not just from an investment perspective. And VCs in general, I feel like bring way more than just investment. In my personal experience, I have once pitched to a VC, and they were like, they didn't fund us, but they gave us a lot of good pointers, like how we have this health data that we can, like, create information for the government, for other public health organizations that could be helpful for them. But the idea came from them. So from that perspective, I feel like, they can just maybe go to you and seek your support when they need in terms of policy, or if there's a platform that is built by the government, how they can take advantage of that. So thank you.
That is the important thing you mentioned, that it doesn't have to be our portfolio startup, but it could be any startup.
Thank you so much. And in the interest of time, I'd like to open it. I have a lot of questions for all three of you, because you brought out so many good points. Like, I've taken lots of notes here, but I want to open it up to the audience and see if we have some questions over there and we can answer. I already see one question from Fida Bhai from USAID, a question for Hasan Bhai. Can Startup Bangladesh advocate for reforming Public Procurement Rule 2008 to include provision of Government of Bangladesh to procure health services from the private sector?
Yeah, I mean, that is a good question, right? So all the legal things that involved in here, I don't know what they are, but I am definitely interested to learn more about it. And if there's an opportunity to improve, to bring efficiency, to bring equity, definitely will work with you to see how we can shape up that policy. I'm definitely open to it.
Thank you so much. Any other questions? All right.
Just like
sorry.
They can just raise their hands and we can bring them in.
Hi, this is Rashidun Nabi. Can you hear me?
Yes.
Okay. Thanks. I have a question to Emon Bhai. So Emon Bhai, I mean, still, I mean, jeta dekhchi Bangladeshe je there are a lot of health tech startups or healthcare niye kaaj korche oneke startup, but and most of the time either accommodating the service or like a marketplace approach, athoba some screening or diabetics and other things. But I don't see any innovation in health technology. Okay, so what do you think? Like, we have a fantastic university like BUET or RUET and other things. So what we should actually do to actually encourage those engineers, okay, to develop few develop some medical technology in Bangladesh in terms of like the need we have, because amader deshe, I mean, there are a lot of medical technology যেগুলো বাইরে আছে, but not applicable in our country in terms of price and also the conditions and other things. So how we can actually encourage those engineers to develop those things? Just one of my experience I would like to share. So currently I'm based in Bangkok and I'm working with few universities here in their startup innovation hub, and I have seen like a lot of universities are actually encouraging their students to come up with new biomedical technology and other things. So I really miss that things like what we don't have anything in Bangladesh yet, and how actually we can promote it.
Okay, sure, Rashid Bhai. Good to see you here. Good to hear from you. So thank you for the question. যেটা হয় যে আমি যদি এভাবে বলি, আমার আন্ডারস্ট্যান্ডিং এ দেয়ার মাইট বি টু বিগ রিজনস যেই কারণে আমরা ওই পরিমাণ স্টার্টআপ ডাইরেক্টলি টেকনোলজি ইনোভেশন নিয়ে খুব বেশি দেখি না। এটার একটা রিজন হচ্ছে কি, when we are talking about startups and not social enterprise মডেলে, মোস্টলি বিজনেস ফরম্যাটে, তখন অবশ্যই তাদের ইনভেস্টমেন্ট রেজ করার জন্য বা তাদের আলটিমেটলি গ্রোথের জন্য ফাইন্যান্সিয়াল আউটকামটা খুব ইম্পর্টেন্ট। সো এটার পোটেনশিয়ালটা সলিড হওয়াটা দরকার। এবং যে কোনো টেকনোলজি ইনোভেশন আলটিমেটলি যে আউটকামটা, প্রোডাক্টের যে আউটকামটা, এই আউটকাম যে প্রোডাক্টটা, এই প্রোডাক্টটা কে কিনবে বা এটার মার্কেটটা কতটুকু বড়, সেটা আসলে is a driving factor, is a factor that drives the intent, to my understanding. So this is one reason যে আমাদের এখানে ওরকম OEM প্রডিউসার, একদম ডাইরেক্ট ইকুইপমেন্ট প্রডিউসার বা ওইরকম ইয়েতে হেলথ কেয়ারের জন্য ঠিক ওইভাবে এখনো এক্সিস্ট করে না এই মার্কেটটা, আমার আন্ডারস্ট্যান্ডিং অত বড় মার্কেট না, যে কারণে ইট ডাজন্ট অলওয়েজ এনকারেজ পিপল টু ডু আ জেনুইন ইনোভেশন অ্যান্ড ডেভেলপ আ প্রোডাক্ট, টেকনোলজি বেসড প্রোডাক্ট, যেটা তারা রেডিলি একটা মার্কেটের কাছে, একটা রেডি মার্কেটের কাছে সেল করতে পারবে। দিস ইজ ওয়ান রিজন আমার আন্ডারস্ট্যান্ডিং এ। আর সেকেন্ড আরেকটা রিজন হতে পারে, এগেইন আই মাস্ট অ্যাকনলেজ, ফার্স্ট অ্যাডমিট যে এই বিষয়ে আমার জ্ঞান বা এই বিষয়ে আমার আসলে থিঙ্কিং অত ডিপ না, আমি আমার সার্ফেস লেভেল নলেজ থেকে যতটুকু বুঝি সেটা আমি শেয়ার করছি। আর সেকেন্ড যে জিনিসটা রিজনটা আমার কাছে মনে হয় হতে পারে, সেটা হচ্ছে গিয়ে অ্যাকসেপ্টেবিলিটি। যে কোনো মেডিকেল ডিভাইস, যে যখন এটা হেলথ কেয়ার রিলেটেড, যখন এটা মেডিকেল টেকনোলজিটা অবভিয়াসলি আসবে মোস্ট কেসেস ইন দ্য ফর্ম অফ এ ডিভাইস, সেটার ভিতরে এমবেডেড সফটওয়্যার থাকতে পারে, অনেক টেকনোলজি, হাই এন্ড টেকনোলজি থাকতে পারে, বাট ইভেন্চুয়ালি ইট উইল কাম অ্যাজ ইন দ্য ফর্ম অফ device which will help practitioners or medical professionals to diagnose people or execute treatment procedures. So either case দুইটার আসলে acceptability is very important, কারণ acceptability জন্য we all know যে কোনো ডিভাইসের জন্য ইভেন বাইরে যখন আমরা দেখি, যে আমরা অলওয়েজ দেখি এটা CE সার্টিফাইড কিনা, এটা FDA, সো অ্যান্ড সো ফোর্থ, এরকম অনেক রকমের অ্যাপ্রুভাল অথরিটির দিকে তাকাই। সো একটা হচ্ছে কি মার্কেট সাইজ, আর একটা হচ্ছে কি এই অ্যাকসেপ্টেবিলিটি অ্যামাং দ্য লোকাল ডক্টরস, অ্যামাং দ্য লোকাল প্রোভাইডার্স, এটাকে ক্রিয়েট করাটাও যেমন ট্রিকি, আবার অ্যাকসেপ্টেবিলিটিটা তাদের কাছে আসলে অ্যাডপ্ট করানোটাও আই থিঙ্ক কুড বি রিয়েলি চ্যালেঞ্জিং। দিজ আর প্রবাবলি দ্য টু বিগ রিজনস যেটা আমার মাথায় আসে, দ্যাট ডাজন্ট অলওয়েজ এনকারেজ একদম real innovators in focusing more on technology innovation into devices or applications.
Thanks,
I
Emon.
hope I could answer.
Yeah, I think you mentioned two great points. I think third director issue that actually mindset is still actually, I think the founders we have in Bangladesh, like still, I think, I mean, we most of the time think about only Bangladesh market rather than not the world as a market or global as a market. There are few startups here actually who are actually thinking global as a, like the whole world as a market. Okay, and you see now a lot of countries like Singapore, even Thailand and other things, they are actually encouraging other countries founder to come there and incubate their idea, testing their idea. Okay, so I think we should also, I mean, through Startup Bangladesh or other initiative we have, I think we also now should actually encourage our founders, young founders or potential founders to actually think global as a market rather than just not only focusing on Bangladesh. And whenever we are focusing on Bangladesh, due to the smartphone penetration, internet penetration, we focus mostly in the big cities. Okay, so rather if we start, like we have a brilliant.
Thank you, Rashid bhai. Really
Sorry,
appreciate
Tazin bhai, sorry, taking the
time. Just শেষ করতে হবে, আমাদের আরেকটা প্যানেল আছে। আমি জাস্ট একটা কোয়েশ্চেন, বাট আই উড লাইক এ কমেন্ট অ্যাকচুয়ালি ফ্রম আওয়ার প্যানেলিস্ট অন দিস। আমাদের মামুন ভাই CMED এর উনি একটা কোয়েশ্চেন করেছে যে can we see more collaboration or collective effort to change health system? So এই জায়গাতে আমি প্যানেলিস্টদের কাছে, আমাদের হাতে একদমই সময় নেই, জাস্ট এক লাইন বা দুই লাইন একটু কমেন্ট চাবো যে how can we work together, because আমি সবসময় বলি যে হেলথ কেয়ারে we need more collaboration than competition, but startups are typically competing, healthcare providers are competing, for-profit businesses are competing, but এইরকম environment how can we work together? আমি একটু আমাদের ফাউন্ডার্স যারা আছে, ডক্টর ফারহিন, ইমন ভাই আর হাসান ভাই, আপনি যদি একটু শেয়ার করতেন।
আমার দিক থেকে আমি যদি বলি, স্টার্টআপ বাংলাদেশের পক্ষ থেকে, যে I mean স্টার্টআপ যারা আছে, বিভিন্ন সার্ভিস যারা আছে, I mean গভর্নমেন্ট, আমরা তো ইনভেস্ট করি, গভর্নমেন্ট ক্যান অলসো বি এ ক্লায়েন্ট, রাইট? যেমন Mamun bhai and some of you guys are collecting a lot of good data, right? When the Praava, even by you guys have a lot of good data on the patients, right? And so if data gula can be used by government in Bangladesh can be client from the data perspective. এবং তারা বিভিন্ন রুরাল এরিয়াতে সার্ভিস নেওয়ার জন্য they can leverage the startups, right? গভর্নমেন্ট অল স্টার্টআপস যে ধরনের ইনোভেটিভ আইডিয়া আছে, ইনোভেশন আছে, সার্ভিসেস আছে, ইফিসিয়েন্সি আছে, এগুলি গভর্নমেন্ট ক্যান লেভারেজ and then they can bring them to the different areas in Bangladesh instead of reinventing the wheel. So that's how government can participate and collectively to be for a better health service in Bangladesh, I think.
Okay, if I may just go next. So আমার মনে হয় যে প্রথম থেকে আমি যে জিনিসটা চিন্তা করি সেটা হচ্ছে গিয়ে এই হেলথ কেয়ার এই নিডটা বা এই প্রবলেমটা বাংলাদেশের জন্য, আমাদের দেশের জন্য স্পেশালি ইটস এ ভেরি বিগ প্রবলেম, লাইক মেনি আদার কান্ট্রিজ ইন দ্য ওয়ার্ল্ড। আমাদের জন্য হেলথ কেয়ার ইজ এ বিগ প্রবলেম এরিয়া। সো এই জায়গায় যে জায়গায় যত বড় প্রবলেম তত বড় অপরচুনিটি। অপরচুনিটি সাইজটা আসলে এত বড়, এখানে কম্পিটিশনের আগে কোলাবোরেশন জিনিসটা আসা দরকার ফর দ্য সেক অফ এভরি ইন্ডিভিজুয়াল পার্টিসিপেন্টস গেইন। প্রত্যেক যখন আমি প্রথম স্টার্ট আপ করি তখন আমি চিন্তা করতাম যে যদি আরো 5টা আসে তাহলে হয়তো হেল্প হতো মানুষের মাইন্ডসেট চেঞ্জ করতে, যে দিস ইজ অ্যান অল্টারনেটিভ ওয়ে, দিস ইজ অ্যান অল্টারনেট ওয়ে টু টেকিং দ্য সেম সার্ভিস ইন আ বেটার ওয়ে। কিন্তু এই মাইন্ডসেটটা চেঞ্জ করার জন্য যে টাইম, মানি, কমিউনিকেশনে যে ইনভেস্টমেন্ট প্রয়োজন, সেই ইনভেস্টমেন্ট একা একটা অর্গানাইজেশন একটা ইনিশিয়েটিভ করে কুলাতে পারবে না। সো ইন দ্যাট ওয়ে ইভেন একই প্ল্যাটফর্মে থেকে একই সার্ভিস অফার করেও আসলে কোলাবোরেট করা সম্ভব। কোলাবোরেট বলতে অনেক সময় জয়েন্ট ক্যাম্পেইন করা সম্ভব, অনেক সময় জয়েন্ট প্রোগ্রাম লঞ্চ করা সম্ভব, যে প্রোগ্রামটার ক্যাপাসিটি হয়তো ইন্ডিভিজুয়াল একটা স্টার্ট আপের নাই, জয়েন্টলি করলে ওই ক্যাপাসিটিটা বিল্ড আপ হয়। So this is one way of collaborating, and the second way of collaborating is through complementing each other. So there are different kinds of startups. Like for Praava, I represent Praava today. So Praava is a basically outpatient healthcare service provider with innovations for enriching quality of service delivery. So in that case, Praava is a brick and mortar plus click model. But most of the startups we see in the healthcare ecosystem are mostly clicks. So I see a lot of opportunities to collaborate and build services for people যেখানে হয়তো ফিজিক্যাল সার্ভিস প্রোভাইডিং কেউ কিভাবে করে কাস্টমাইজ করা যায়, কেটার করা যায়, কিভাবে এক্সপিরিয়েন্স এনহ্যান্স করা যায়, সেদিকেও যেমন ভ্যালু অ্যাড করতে পারে হয়তো প্রাভা, অন্যদিকে হয়তো অন্য একটা স্টার্ট আপ যে টেকনোলজি দিয়ে, যে তার রিচ দিয়ে বিশাল বড় স্কেল তৈরি করছে, সেখানে হয়তো এই কোলাবোরেশন, এই কমপ্লিমেন্টিং ইচ আদার কুড ক্রিয়েট মাচ লার্জার ভ্যালু ফর দ্য পিপল। সো আই সি কোলাবোরেশন না হওয়ার বা এই মাইন্ডসেট না থাকার স্টার্ট আপ ফাউন্ডারদের কোনো কারণ থাকা উচিত।
Thank you.
Thank you.
And Fahreen, if you can just.
জি জি, আমি খুব ছোট করে বলবো, জাস্ট 2 মিনিটে শেষ করব। রিসেন্টলি আমি একটা হেলথ কেয়ার ইনকিউবেটর প্রোগ্রামে যাই, যেটা নাম ছিল সিমকিউবেটর। সো আমি ওখানে যখন যাই, ওটাতে যাওয়ার একটাই রিজন ছিল, সেখানে স্পেসিফিকলি শুধু হেলথ কেয়ারদের জন্য ইনকিউবেশন ডাকা হয়েছে। এবং আমি যখন গেলাম তখন দেখলাম যে আমি ওখানের জন্য একদমই মানে কি বলে ফিট না, বিকজ ওখানে একদম আর্লি স্টেজ যারা আইডিয়া নিয়ে তারা এসছে। তা আমি কেন গেলাম? আমি গেলাম এই জন্যই যে হেলথ কেয়ার নিয়ে কারা কাজ করছে এই আগ্রহ থেকে গেলাম। এবং আমি এখানে বলতে চাই যে প্রফেসর মামুন ভাই ওখানে মেন্টর ছিলেন, হ্যাঁ, তো উনি আমাকে এই কোয়েশ্চেনটা করেছিলেন যে তুমি ওখানে কি করো। তা আমার কিন্তু খুব লাভ হয়েছে একটা, সেখানকার আরেকটা স্টার্ট আপের সাথে আমি কিন্তু এখন কোলাবোরেশন করে আমি যে রুরাল প্রোগ্রামগুলি করছি বা যে কাজগুলি করছি সেটা আমি করতে পারছি কোলাবোরেশনে। তো কোথায় আমাদের, আমি এই জিনিসটা নিয়ে আমার নিজের কাছে বাংলাদেশে যে কয়টা হেলথ কেয়ার স্টার্ট আপ আছে আমার নিজের কাছে সেই লিস্টটা আছে। প্রবলেমটা কোথায়? প্রবলেমটা হচ্ছে নেটওয়ার্কিং। হ্যাঁ, সবাই কিন্তু ইন্টারেস্টেড। যেমন কয়েকটা স্টার্ট আপের নাম আমি বলতে চাই, যেমন ব্লাডম্যান, তারা কাজ করে হচ্ছে রক্তদান কর্মসূচি নিয়ে। আমি কাজ করছি ডায়াবেটিস নিয়ে, মনের বন্ধু কাজ করছে মেন্টাল হেলথ নিয়ে, সিমেড কাজ করছে ডিভাইস নিয়ে, জেনারেল প্র্যাকটিস নিয়ে, তো এরকম জিপি মডেল নিয়ে। তো এরকম আমরা কিন্তু এক একজন এক এক সেক্টরে কাজ করছি। আমার ল্যাব কাজ করছে পুরোপুরি ডায়াগনস্টিক নির্ভর, এরকম অনেক আছে, টেলিমেডিসিন নিয়ে কাজ করছে অনেকে আছে। সো আমাদের হেলথ সিস্টেম কিন্তু শুধুমাত্র টেলিমেড সার্ভিস নির্ভর না, আমাদের ডায়াগনস্টিক লাগে, আমাদের বিলিং লাগে, আমাদের ডিভাইস লাগে, আমাদের কি বলে এটাকে সার্ভিস লাগে, আমাদের প্রোডাক্ট লাগে, সবকিছুই লাগে। এটা যদি নেটওয়ার্কিংটা যদি, যেমন আমাদের আইসিটি ডিভিশনের খুব সুন্দর একটা অফিস আছে, সেখানে আমাদেরকে পারফরমেন্স কমিটির কাছে আমাদেরকে পারফরমেন্স মনিটরিং কমিটির মিটিং এর আমাদেরকে যেতে হয় প্রত্যেক মাসে বা 2 মাস পর পর। সেখানে গেলে আমরা হেলথ কেয়ার স্টার্টআপ কিছুকে পাই। সো এই নেটওয়ার্কিং গুলি যদি গভর্নমেন্টের পক্ষ থেকেও আসে বা যে কোনো, যেমন লাইটক্যাসল পার্টনার আছে, তারপরে এরকম আরো অনেক অর্গানাইজেশন আছে, যেমন আজকে আমরা অনেক হেলথ কেয়ার স্টার্টআপদেরকে নিয়ে কথা বলছি, তাদের খুব ইনিশিয়েটিভ গুলি যদি নেওয়া সম্ভব হয়, তাহলে আমার মনে হয় যে এই মামুন ভাই যে কোয়েশ্চেনটা করেছেন এটা খুব দ্রুতই আসলে চ্যালেঞ্জটাকে ওভারকাম করা সম্ভব। কারণ কি, প্রত্যেকটা স্টার্টআপ তার নিজের যে কেপিআই থাকে সেটা নিয়ে প্রতিদিন দৌড়াতে, হ্যাঁ, তাদের কাছে 24 ঘন্টা অনেক কম। সো ওইটার বাইরে তাকে ফোর্স যদি না করা হয় তাহলে সে যায় না। সো ওইখানে আমার মনে হয় যে যদি গভর্নমেন্ট থেকে একটা ইনিশিয়েটিভ নেওয়া যায় তাহলে আমাদের জন্য খুব হেল্পফুল হয়। থ্যাংক ইউ।
All right. Thank you so much, Dr. Fahreen. Thank you, Emon bhai. Thank you, Hasan bhai. Very lively discussion and lots of follow-up questions. So hopefully we will see some continuation of this discussion. এবং লাস্টে যেটা বললাম আমরা যে আসলে কোলাবোরেশনের জায়গাটা তৈরি করা এবং সেখানে maybe startup Bangladesh can also play a role. And I look forward to working with all of you and LightCastle Partners again, like, maybe we can create something to continue this discussion. So with that, again, thank you, everyone. And I'll hand over to Mehad again, thank you.
Thank you so much, Tazin bhai, Fahreen Appa, Emon bhai, Hasan bhai. It was a lovely discussion. It was very insightful. Majani ji, 1 hour is not enough, but definitely we have received a lot of insightful comments from you all, and definitely we want to continue this discussion way forward. But nevertheless, we want to move to our next panel discussion, which is on the Bangladesh health sector and the upcoming opportunities, which will be moderated by Bijon Islam, who's a co-founder and CEO of LightCastle Partners. So I'd like to give a quick introduction of our panelists for this session. First of all, we'll start off with Ms. Shaila Purvin, who's the CEO of Surjer Hashi Network. And she is a dynamic leader and currently leading this USAID's initiative across hundreds of clinics in Bangladesh. And previously, before this, she has been working at Praava and has led one of its enterprises for 3 years, before which she has spent a successful decade as a seasoned marketeer, working for global tech giants like Dell, Samsung, Orsaline, and Famicom and SMC. Shaila, it's so nice to have you today. Thank you for joining in. Next, I'd like to introduce Dr. Ishtak Zahid, who's the co-founder and the chief operating officer of AmarLab. He has been working in the public health sector management for over 15 years, and he has immense expertise in working with healthcare data. Previously, he has worked with Spriha for over 8 years, serving as the director of programs. Ishtak bhai, thank you so much for joining. Next, I'd like to introduce Dr. Khondaker Mamun, who's the founder and chairman of CMED, which started back in 2015. And those who doesn't know what CMED is, it's a cloud-based medical system that is low cost, affordable, and easy to access, targeted for the people of Bangladesh. That can be used to monitor and prevent health risks at an affordable cost. Other than this, he is also a professor of digital health at United International University for 8 years. He's also the founder and director of Advanced Intelligence Multidisciplinary Systems Lab. He holds a PhD in biomedical engineering from University of Southampton and a postdoctoral fellowship from University of Toronto. Thank you, Mamun bhai, for joining in. For everyone, I have a sad news that Dr. Abdul Motenimon was not being able to join in today due to a medical emergency, but definitely we look forward to host him in our future events. So I'd like to hand it over to Bijon bhai, who's the CEO of LightCastle Partners. Those who doesn't know LightCastle Partners, it's a management consultancy firm which focuses on data-driven opportunities for growth and impact for development partners, corporates, SMEs, and startups. Previously, before founding LightCastle, Bijon bhai, he has worked with Citibank NA and Citi Foundation and oversaw the execution of Bangladesh's first interest rate swap, equity convertible bonds, largest IPO, and other types of financial instruments. So thank you so much, everyone, for joining today. And Bijon bhai, I'd like to hand over the mic to you.
Thank you. Thank you for staying with us. I know it's been a kind of like a long day, rainy and everything, and it may have also pinging me so that I stay very much on time and don't digress, right? And I'm excited to have a very power-packed panel with us. Unfortunate Tushar bhai not being able to join us, but I mean, we still have a very influential and a long-standing health sector professionals with us on the panel. Maybe I'll start up with Shaila, who is the CEO of the Surjer Hashi Network, or the Smiling Sun Network, as we popularly call it. Shaila, can you hear me?
Yes, I can hear you.
Perfect. Thank you, Shaila. I know that I'm just going to, again, everyone possibly already knows this, but just to give a bit of background that the Smiling Sun Network or the Surjer Hashi Network currently operates, I think, 134 clinics.
Yes.
And this definitely has a high quality health impact, especially to the lower middle income group, right? And help them achieve financial and health sustainability, right? So if you could also, for the room, could you tell us a bit about your work and how with these growing complex populations, this demographic bulge, how is the Smiling or the Surjer Hashi network is keeping up? So if you talk a bit about your network, some of your learnings, that would be very helpful. Shaila, over to you.
Thank you very much, and thanks to the organizers for bringing us together. I think it's a great opportunity to know each other and find out opportunities for future collaboration, if scope is there, definitely. Surjer Hashi Network's journey is very long. It's 25 years. And if I divide this into two sub-periods, one is the 21-year period that was managed by several NGOs up until 2018, 2018, starting from 1997. And the next journey under Surjer Hashi Network as a company, as Mr. Fida Mehran from USAID already said, this is a not-for-profit company in the form of association, and it is not-for-profit under Section 28. So, as you said about impact, how it is meeting the growing need, the 21-year period witnessed Surjer Hashi to become a very trusted name among the community across Bangladesh, with 399 clinics and over 64 districts. And it was in a time when government was still building its capacity. So it was really required. What that period, I think, did not see was a meaningful growth towards sustainability. And that's not uncommon. Following the formation of Surjer Hashi Network, that not-for-profit company in 2018, the 4-year period has witnessed a sort of shift in USAID policy and program priority. And that also resulted in a shrunk network, but yet enhanced focus on quality and, of course, a lot of revamping initiatives to create a stronger network that can move meaningfully towards sustainability. So this period has rather seen a predictable way of stepping up and making this journey. So health impact-wise, I would say Surjer Hashi Network has made a very strong impact all through, in a country where, there is about, I guess, if I'm not wrong, 18 to 20 doctors per 10,000, and about slightly more than one doctor per 10,000 people. So the need is there. And in the requirement of ocean, I would say, where the government is also trying its level best, the requirement for Surjer Hashi's services is at least a river, but a river with pure water, and that is, available. So why I'm saying this? Because of the quality services that Surjer Hashi Network is providing and at affordable cost. So, and that journey is going on even with this 134 clinics and hubs plus satellite spots that we have, which help us to connect with the hard-to-reach areas. This network is continuing and trying to make impact without further, shrinking down. So that's all about Surjer Hashi Network. And if you say about the growing need, I think quality health service is the main thing at affordable prices from the community. And in this space, by quality, I just don't mean the technical services that Surjer Hashi is providing. It's also the kind of behavior, that feel-good factor, that when customers walk in and when they walk out, leave the premises, the experience they live with is something that is meaningful and that is basically creating that huge word of mouth, has been able to create that huge word of mouth for Surjer Hashi network. Yes.
Thank you, Shaila. I think that's very helpful, and thanks for all the hard work that the SHN network definitely does, and I'm excited to see what the future holds. Possibly, I'll go to Dr. Khondaker Mamun next, the founder and chairperson of CMED. First of all, Mamun bhai, I like your background that it's moving, shows CMED's work, so gets a bit of things out. But again, coming back to CMED, right, which is as we understand is a cloud-based health monitoring system, and it started with the rural population and possibly moved into urban, peri-urban areas, right? And so, if you could explain a bit more of how does exactly your business model work, what kind of build, and what are some of the impact parameters you look at as you build your business model around that, because we also understand that if you have very strong impact indicators and everything as well. So if you could enlighten us a bit about CMED, how it works, and your history, that would be helpful. Mamun bhai, over to you.
Thank you so much, Bijon bhai, and Assalamu alaikum, and very good afternoon to everyone. And thank you so much for inviting me to sharing our experiences. So I think I would like to share one example. I don't know, everyone knows. CMED actually came out from an R&D in Bangladesh in the university lab. CMED was a research project in the university, and later that was patented and then published in international journal. And then it was actually commercialized from research to commercial model, and with a small funding from ICT division. So I would like to tell you the history of CMED. And like when I came back from Canada to Bangladesh, I actually tried to look into what are the problems in healthcare and why people are suffering. And also my mom also suffered in healthcare for a lot of things. I don't want to share, it's a long story. So at that time, I found that for my mom, I managed with my knowledge, expertise, and my technological approaches. But আমাদের দেশে অনেক মা আছে, মিলিয়নস অফ মা আছে যাদের আমার মতো ছেলে নাই। সো আমার কাছে মনে হলো যে আমি প্রবলেমগুলো আইডেন্টিফাই করি এবং ফোর্থ ইন্ডাস্ট্রিয়াল রেভলিউশন, এআই, আইওটি, এই টেকনোলজিগুলোকে কিভাবে অ্যাডপ্ট করে সলিউশনটা তৈরি করতে পারি। দ্যাট ওয়াজ দ্য অ্যাকচুয়ালি মডেল। অ্যান্ড যে প্রত্যেকটা মানুষের একটা করে হেলথ অ্যাকাউন্ট থাকবে, তাদের রেগুলারলি সে কাজে থাকুক বা বাড়িতে থাকুক, যেখানে থাকুক তার হেলথ মনিটরিংটা করা হবে, এবং সেখান থেকে তার হেলথ রিস্ক অ্যাসেসমেন্ট করে তাকে রাইট প্লেসে রাইট রিসোর্সের সাথে কানেক্ট করা হবে। এবং এই মডেলটা যখন আমরা পেটেন্ট করে পাবলিকেশন করলাম ইন্টারন্যাশনাল জার্নালে, তখন উই গট এ হিউজ ফিডব্যাক অ্যান্ড গাইডেন্স ফ্রম মেনি ডক্টরস ইন বাংলাদেশ। দেন এই রিসার্চটা আমরা কমার্শিয়াল কোম্পানি করলাম। সো এখানে আমরা 2016 এবং 17 আমরা মডেল আইডেন্টিফাই করার চেষ্টা করলাম যে কিভাবে আমরা এটা করতে পারি। সো আপনি জেনে খুশি হবেন, এই মুহূর্তে CMED রুরালে বাংলাদেশের 65টা ইউনিয়নে একবারে A to Z সকল মানুষের হেলথ অ্যাকাউন্ট করে প্রায় 900 হেলথ ওয়ার্কারের মাধ্যমে PKSF এর সাথে পার্টনারশিপের মাধ্যমে 17 লক্ষ মানুষকে এভরি মান্থ তাদের ডোর স্টেপ হেলথ চেকআপ, AI based risk assessment and refer করে to the GP doctor and the diagnostic center and referrals. এর বাইরে আমরা আরবানে ইউনিসেফ এর পার্টনারশিপে আমরা অলরেডি 6টা ক্লিনিক লঞ্চ করছি। আলো ক্লিনিক, যেটা হচ্ছে এটাও একটা মডেল। এটা হলো মানে আরবান এবং রুরালে জিপি মডেল আকারে আমরা কাজ করতেছি। একটা ক্যাচমেন্ট এরিয়া, আরবানের জন্য ওয়ার্ড আর রুরালের জন্য ইউনিয়ন। ইউনিয়নে একজন ডাক্তার থাকবে, ডাক্তার হচ্ছে ওই এলাকার হেলথ গার্ডিয়ান। আমাদের যেমন ইউনিয়ন চেয়ারম্যান থাকে বা ওয়ার্ড কমিশনার থাকে, উনি হচ্ছে আমাদের পলিটিক্যাল গার্ডিয়ান। সো হাউ ক্যান উই এনশিওর এ হেলথ গার্ডিয়ান, যে হেলথ গার্ডিয়ান আমার ওই এলাকার নিউ বর্ন টু যারা আছে সবার হেলথ টেক কেয়ার করবে। এবং ডাক্তারের কাছ থেকে যখন রোগী বের হবে কনসালটেশন করে, রোগী বলতে হবে যে আমি আসলে এরকম কেয়ার কখনো পাই নাই। তার মানে হচ্ছে ডাক্তার আসলে রোগীর সাথে তার এমপ্যাথি দিয়ে, তার ইমোশন দিয়ে তাকে কানেক্ট করবে, যেটা আমাদের দেশে মিসিং। আপনারা জানেন যে বাংলাদেশে আমাদের ডাক্তাররা অনলি 2 থেকে 3 মিনিটের বেশি সময় দেন না, এবং আমাদের ট্রাস্ট এবং কোয়ালিটির অনেক ঘাটতি আছে। এবং আমাদের দেশের মেজরিটি একটা পোর্শন ইন্ডিয়াতে চলে যায়, এবং প্রচুর আমাদের ডলার চলে যাচ্ছে বিদেশে। সো আমরা সে জায়গাটায় কাজ করছি। এর বাইরে আমাদের একটা সুস্বাস্থ্য প্ল্যাটফর্ম আছে, যার মাধ্যমে আমরা যে কোনো ফার্মাসিতে কেউ যদি যায় সাথে সাথে তার সিমটম এআই বেসড সিমটম চেকারের মাধ্যমে তার হেলথ রিস্ক অ্যাসেসমেন্ট করে তাকে কানেক্ট করা হয় ডাক্তারের সাথে বা রিসোর্সের সাথে বেসড অন দ্যাট সে রেফার করে ডায়াগনস্টিক সেন্টার লাইক এন এয়ারবিএনবি মডেল ফর কানেক্ট হসপিটালের সাথে কানেক্ট করে এবং নিয়ে আসে। এর বাহিরে আমরা কাজ করি হচ্ছে কর্পোরেট অফিস বা ফ্যাক্টরির সাথে, কারণ হেলথ কেয়ার কিন্তু শুধু বাসায় হবে না, শুধু ডাক্তার সেন্টার না, হেলথ কেয়ার মানে হচ্ছে আমার ওয়ার্ক প্লেস একটা ইম্পর্টেন্ট জিনিস। সো আমরা ওয়ার্ক প্লেসে হেলথ কেয়ার দিচ্ছি যে প্রত্যেকটা এমপ্লয়ের একটা হেলথ অ্যাকাউন্ট থাকবে এবং তার রেগুলার হেলথ রিস্ক অ্যাসেসমেন্ট হবে এবং তারপরে হেলথের কন্ডিশন অনুযায়ী তাকে রেফার করা হবে। সো ওভারঅল আমি যদি বলি, CMED is a digital health inclusion model for universal health coverage in the era of fourth industrial revolution. আমরা টেকনোলজি এনেবল প্ল্যাটফর্ম ইউজ করে কিভাবে প্রত্যেকটা সিটিজেনের হেলথ অ্যাকাউন্ট এনশিওর করতে পারে এবং প্রত্যেকটা ট্রানজাকশন অফ দেয়ার হেলথ can be captured, and based on that we want to predict their future health risk, like when they have a risk of stroke, heart attack, diabetes and so on. এবং এটার মাধ্যমে আমরা আসলে সারা বাংলাদেশে একটা হেলদি নেশন ক্রিয়েট করতে পারবো। এবং বিজন ভাই, আমি একটা মডেল যেটা তৈরি করেছি, ইউ নো দ্যাট উই $1 হেলথ সার্ভিস, $1 পার ফ্যামিলি পার মান্থ, এই মডেলটা আমরা এখন ইমপ্লিমেন্ট করছি। ইফ উই ক্যান মেক ইট হ্যাপেন, it could be a model not only for Bangladesh, it could be a model for all developing countries, that $1 primary and preventive health care for universal health coverage. Thank you.
Thank you, Mamun. I think this is super useful. I really like that we keep on talking about the industry academia gap. So I'm happy that CMED came out of the research and development division of the university. I think that's really great. And the vision of CMED, how it has worked, and towards the end that you mentioned, that $1 health prevention for everyone. I think that's good, and I'm really glad and can't wait to see where CMED kind of takes this journey. With that, I'm moving on to Dr. Ishtak Zahid, the co-founder and the chief operating officer for AmarLab, another rising health tech healthcare services company. So Zahid bhai, I think we know that about AmarLab was on the cohort of Accelerating Asia, and the leading Singapore-based accelerator program. Currently, we're raising investments from both international and local investors, and you have come a long way from where we started in 2017. So, if you tell us a bit about AmarLab, what are some of the things you have worked on, or what you are working on right now, and what are some of the challenges of your early days? Yeah.
Thank you, Bijon bhai. The early stage was very challenging for us. Not a lot of things worked out for us. The number thing was the great customer experience. That was our main key focus. Our sample collection kit bag, cold chain maintenance, expert medical technologist, and the cost efficiency was accepted and appreciated by the customer. Just one service or one trial from us, every customer come back to every time. So number two was the customer retention. It was 94% of the customer returned to us when they needed. I remember one of the customer was telling me, "Erkom ekta service আছে আমরা জানি না কেন." At that time, we were about in the market for 2 years. Come back to the challenge, the model itself was the challenge. It was difficult to understand both for the patients and the diagnostic labs. We have to answer two questions every time. Where are your lab location? Who does the test? People don't understand the marketplace, even the diagnostic labs also. The customer concern was another part of the challenges. Customer concern about the test quality and result. Asking, how do I know you will maintain the quality? Reports are authentic. Do you do the test, or you just print the report out? We did a year-long research on sample collection and transportation, and that helps us to overcome that part. Lab saw us as a competitor or as a partner. We have to repeatedly sit with them. We did countless meetings with them and explain the model, the benefit. It is difficult to make someone understand when they are already in the successful business market in a conventional way. But all the hard work pays off. Now we have 30 diagnostic centers in our partner lab and under 10 brands. That's the journey.
Thank you, Zaid. I think this is super helpful to understand, and I'm glad that you're putting all the hard work. I really like that. One of the things that you took very seriously was data, right? You actually tracked what was happening throughout there, and that really helped, I think, build out a competitive advantage for AmarLab. And I know my family members have used your services, and they were really happy that they could do this sitting at home, which often sometimes gets very difficult. So yeah, kudos to you on building that. I think I'll have time for one round of questions because I know that we have to end sharp at 6. So I'll go back to Shaila. Shaila, one of the things that are again coming up from time to time is that Bangladesh is going to go through the LDC graduation in 2026, hopefully, and that would mean that the way the funding works throughout health systems, education, or any other sector is going to change, right? Given that Surjer Hashi network has a huge impetus on the development side, how do you see that change happening once Bangladesh graduates, and how do you think the Surjer Hashi network will work possibly not only in rural but also between in urban low to middle income areas while becoming more sustainable in nature? So how do you see that journey happening for Bangladesh? What impact it will have on the health sector, and by what is Surjer Hashi network doing to kind of fit for that journey as well? So Shaila, over to you.
Okay, thank you very much. Well, at one point we are seeing, we have been seeing this graduation, and then again, there are challenges that are also coming up. So where we are currently, that's a big question mark in terms of, country's economy and the challenges that we're facing. With growing inflation, people's purchasing power has come down again. And we don't know where it is going to end, despite a lot of initiative that is being taken, but still the challenges are there. I already discussed about the impact that Surjer Hashi network has been, making throughout the period over the years under NGO management and also under Surjer Hashi network over the last 4 years. I believe that the growing need for, no matter whatever economic condition you are, the growing need for healthcare is there and will be there. And especially for the people, even if it is in the urban areas, who Surjer Hashi network is serving for. Currently it has 110 clinics in urban areas, including the down areas, although called urban, and the rest are in rural areas. And for this low to middle income, and if I say middle income, that will not be the exact word, that should be lower middle income. So these people will always be in need of, quality healthcare at affordable services. So, and there are constraints, resource constraints. We have been trying our level best to, reduce donor dependence. That is also what USAID wanted us to do. And we have reached out to the government. Government also has a lot of priorities. Also, they are very much cooperative and want to be with Surjer Hashi network. Even if something starts small, we believe that there are possibilities that we can work together. There is continued support from USAID, and there are assurance from USAID for future, of course, within their scope and policy requirements. And we are also approaching other donors. So having all these, and with every entity's own priorities, it is very important to find out what are the pillars for a sustainable journey, so that the journey of serving to the people who need it the most can continue. So we have identified about, say, 4 pillars to meaningfully see the journey continue towards the sustainability, so that after completing that step, creating that foundation, that foothold, we can think about the second step. Okay, capacity-wise, as per customer demand, how the organization, the network can build its capacity further, how best it can utilize its human resource, the equipment, and the infrastructure, how it can bring efficiency in the overall operation. And of course, system-based, very strong monitoring is important, and that's where we are focusing on. And we are also trying our level best to bring transparency across all levels. You know, if these things are done, then at least operation-wise, Surjer Hashi network will not have to depend on donors, at least to run the basic operation, plus make small investment to keep the operational running. But yes, of course, once that point is, that layer is reached, then of course to go to the next layer and also to expand its services, say just the way the vision went on, services, health services for all Bangladeshis. So that also includes, upper middle class and middle class. If I say, the definition is different in different cities. In Dhaka city, see, who are the middle class people? And out of Dhaka city, who are the middle class people? Say say apart from Dhaka and Chittagong, who are the middle class people? So therefore, to expand our services to them, definitely more investment will be required in future. But that's a different vision, I would say, we have to think about later. There are many conversations going on about impact investment, blended financing and things like that. But I guess we are working on the basics, and as I said, the 6 pillars, where a proper completion of all these things, as we're already stepping into and doing, is going to give a very strong foothold, so that the people, even with their limited income or the income that has gone down in reality, they can still afford to come to Surjer Hashi network. And we can also expand our services from the same facilities by, as I said, bringing operational efficiencies and also utilizing the spaces where there are more services we can provide from the same space. Say we have, as you know, we are in the mother and child health care, family planning. From the same space, say, where the basic clinic is not providing any normal delivery services currently, but we are expanding into that so that the demand from the community can be met. They want affordable, health delivery services from a quality healthcare clinic. So these are the ways we are thinking, and I believe that given the current requirement, we are in the right direction, and we are moving towards the that sustainability goal. And by sustainability, I just don't mean financial sustainability of the service, continued service. And once it is reached, we can work towards the next goal. Thank you very much.
Thank you, Shaila. And I think this brings down to the point, I mean, of universal healthcare, right? Healthcare for everyone, right? And of high quality. And, all the best with the journey. And we look forward to seeing SHN becoming a lot more extensive, a lot more growth, all over Bangladesh. So, looking forward to that journey as well. Thank you for sharing your thoughts. I'll move on to Mamun Bhai for a specific topic. I think it comes all the time. I think Shaila was also mentioning about impact investing. I know that CMED has raised all kind of capital, whether it's angels, venture capital, government funds, impact investing, even international investors, for example, like DhakaCast Partners, right? So would you share a bit of your experiences? What are some of the things that worked in your favor that allowed you to raise such a varied amount of investments? And what is your plan on that going forward? Yeah.
Thank you, Bijon Bhai. Investment in Bangladesh is really a challenging task, and you are in that arena, you know that. So in that context, already, Mehad Bhai already showed that among the $800 million investment come to the startup in Bangladesh, and healthcare only raised 30 million. So that actually showing us that how difficult to raise the investment. And here the 2 perspectives. One is the consumer, that who we are actually developing the solution and serving. So our digital literacy and then health literacy is really, really limited in Bangladesh. So this is one of the obstacles for startups to facing challenges to raise the investment. And on the other hand, our ease of doing business in Bangladesh, this is another challenge. So these are the two challenges actually made us different difficulties to raise the investment. And however, that without the challenge, you cannot succeed. So these are the challenges we are facing last 6 years. And I myself, as I came from the R&D to commercializations, I think for investment raise success for CMED actually lead to few things. One is a solid ground of the product and volume and the mass of the problem, that how big the problem is. This is one thing. And the team is one of the big like strength for CMED, from R&D to technology to execution, and the partnership what we made, and also understanding the core of the problem. So understanding the core of the problem is very important. Still, we have many challenges to focus. And lastly, I would say that in our country, if we look into the healthcare had two aspects. Our private clinic actually focused on the middle class and rich people. Our NGOs are focused on the poor people. But we didn't see more universally, as you mentioned, that we are actually in the pathway to achieve universal health coverage, that is healthcare for all, or equitable healthcare in 2030. In that context, we don't have any option to look into that we have APL above poverty line or BPL below poverty line segregatedly. We have to look into comprehensively. So in that context, focusing on all this area, and most importantly, technological strength and founders' ability actually lead us to actually successful in the investment rising. And I would like to say here, we have only 8 years left to achieve universal health coverage. And blended finance is one of the greatest tools. I really appreciate the LightCastle Partner and Bijon Bhai and Mehad Bhai to actually bring out the blended finance concept. And I was also actually participated of some of the workshops. And this is something need to give the boost to actually bring initiatives into the light with a like subsidy or like kind of a capital injection support from the donor side, from the other aspects that is actually missing in this country. So we have a lot of CSR fund. I can give you one example. We have a lot of CSR fund. What we do, we build a clinic, and long time we are giving subsidy to run the clinic. Why not? We actually have a sustainable model. We give some investment and some initiative come with another X amount of investment so that they can do there, and there is a target that in 3 years you should be self-sustaining. So in that way, there is a way we can actually bring more investment in the healthcare sectors. And I would like to share one thing. The healthcare pie in Bangladesh is so big. I don't know how much idea I have. $10 billion pie in Bangladesh. And you will be sad to know that I think Mehad Bhai said it is going to $2.2 billion outside. I think it's double, more than that. It is nearly $4.3 billion going for medical tourism. And I would say $4 billion going to India due to the trust, quality of care. And there is a missing component of healthcare, that empathy, that when our doctors talking with the patient, they are actually selling the service. Rather, if they connect heart to heart, that yes, you are my patient, and when you reach out to me, you don't need to worry about, I am your health guardian, and you will be in a right hand. So that actually trust, attachment, quality of care, and the guardianship, if we can bring through our emotional attachment, our technology platform, our data-driven solutions, together, our healthcare could be a model for the world, because we have 170 million people. Whatever we establish and make successful, that could be easily scalable to all over the world. So that's why I asked the question. We are doing each of the components, everyone. Like CMED is working mainly focusing on preventive and primary health care. There is someone working on diagnostics, someone working on other places. So can we do a consortium? Can we do a collective effort to serve 170 million people so that our broken health system can be fixed, and we actually can show the world that Bangladesh, after 50 years, came out with a new dimension of healthcare, where their model is highly affordable, accessible, qualityful. They can provide safer and timely healthcare service delivery. Thank you, Bijon bhai.
No, thank you, Mamun bhai, for that. I think it expands all your from different facets that allowed you to raise investments to what your vision for not only CMED but Bangladesh is. And I think import substitution has been a big topic. I mean, given Bangladesh is still a net importer, especially for services. The COVID has also showed us, yes, you can definitely go outside, but sometimes that is always not an option, right? There is no alternative to strengthening the healthcare system in Bangladesh, whether it's for the economic benefit, also for ensuring universal healthcare. With that, I'll move on to the last panelist, Zahid bhai. I know that AmarLab started with diagnostic on-demand tools, like you mentioned, but as the needs arise, you have added other services, repertoires, and everything. So could you tell a bit about what are AmarLab's plans for the future, and how does it relate to the growth of the healthcare sector in Bangladesh?
Definitely, healthcare is the integrated solution part. Healthcare is not a single player game. Partnership and referral system is the part of the sector for long times. Healthcare have multi-level sectors or departments, from primary, secondary, tertiary care. If you go to general physician, to super specialist, basic drugs to chemotherapy drugs, even though basic diagnostic test to molecular test. Each department individually is filled with challenges and with lots of barriers. I always say broadly 4D is required for a healthcare. You need doctor, you need diagnostic, you need drugs, and you need data. Data is the glue. Everyone is talking about everything, but no one is talking about the data. Without data, doctor cannot make any diagnosis. A pharmacist cannot produce drugs and everything. So our focus is main on diagnostic part and the data part, and we want to partner with all the health sector service provider to augment our core services. I always share this message with everyone. By nature, people are reactive in health-seeking behavior. People regularly check their car or motorbike, so it doesn't stop in the middle of the road. But when it comes to healthcare, only go to a doctor when you are sick or do a checkup when you are feeling sick. Human body is also a machine, or it's something you need to regularly check. Prevention is better than cure. So our focus is to promote preventive healthcare, making health diagnostic and data available to everyone, not for the patient only, also with the public health department and all the health service provider, because diagnostic data is the largest part. That's our ultimate goal, to make healthcare easily accessible for everyone.
Thank you, Zahid bhai. And what I really like that you said that you will collaborate. I think that's what was the theme of the first panel as well, right? So I'm glad. I think this is a problem we're not going to solve in silos. We all need to come together. With that, I'm receiving reminders from Mehad that, I'm going over time. I do acknowledge that we have 5 minutes and maybe we can take a couple of questions. So feel free to use the chat window or, raise your hands and feel free to ask on that again. I think I would like to take one question that was left out, and that was from Chloe, that we often see international investors talk about repatriation being a challenge. And I know that Mamun bhai, for example, and also AmarLab, you have taken international capital, right? So could you kind of shed a bit of light how you have structured the deal? Maybe Mamun bhai can start, and then Zahid bhai, you can add on.
For ourselves, we are actually watched by some of the investors, impact investors. They are actually watching us around 3 years, 4 years, and they actually looking into our activities. And then at the time, they found that we actually really focusing on our work and growing, and they actually come up with their investment offers. And now we actually raising more investment, and also we are actually focusing on impact investment, because without impact investment, it is difficult to convince, because healthcare is something that actually slowly moving, but when it gets big, that is something great. So I think this is about how you actually drive your business and show your or prove your capacity to execute and grow. I think this is, main thing.
Sure, thank you, Mohan bhai. Zahid bhai, any thoughts from your side, how you have, for the repatriation issue, how do you convince investors internationally to invest in AmarLab?
Yeah, we are always telling the story, because investor actually they want to connect it. I have a very great product, but they don't understand the product. So what's the problem? How you want to fix it? And what's it for me? It's very straightforward. So if you just connect the dots, what we did, okay, this is our product, there is a need, the market is huge, okay, we did the R&D, we can transport the sample, we have the partners. That's how worked for us.
Got it. Thank you, Zahid bhai. There's this very interesting question from Sajid. He has mentioned that Bangladesh has a large population, population that works outside, right? I think in many countries, even in Europe, right? So what are some of the ways that the sector kind of works towards establishing healthcare services for them? So any ideas from the room? I know Shaila, any ideas there, also Mamun bhai and Zahid bhai.
Bijon bhai, I can come here.
Yeah.
We are working with the Middle East countries to actually take our service for our labor market. We are in discussion with Bahrain that how can we actually provide our service, because our Bangladeshi workers who are working in the MENA countries or other countries, they having difficulty to talk with the foreign doctors. So in that context, we are working that how can we provide healthcare services for them. This is, I think, one of the opportunity, and we also looking for more collaborations actually to bring the service to many MENA countries or any countries that actually many Bangladeshi workers are working.
Thank you. And I think with that, we have just 1 minute. We'll take the last question from Alamin bhai from Paintech Valley. Alamin bhai, just go ahead.
আসসালামু আলাইকুম, আমার মামুন স্যারের কাছে একটা কোশ্চেন। স্যার, আপনারা তো মেডিকেল ডিভাইস নিয়েও কাজ করতেছেন, সেই ক্ষেত্রে ডিজিটিএ থেকে পারমিশনের ব্যাপারে কি ধরনের সাহায্য সহযোগিতা পাচ্ছেন?
Thank you. One by over to you. Yeah.
Thank you. So এখানে আমার কোশ্চেন হচ্ছে ডিজিটিএ এর আসলে এখনো ওইভাবে মেডিকেল ডিভাইস ভ্যালিডেশন করার কোনো ক্যাপাসিটি হয় নাই। What we do, we take the permission from the BMRC, do the clinical validation and submit the report, and then actually it gets permitted to actually launch. So with your permission, I would like to offer one thing, that I have an R&D lab in the United University where 18 doctor engineer working together on the health sectors. So I would like to invite you all to visit my lab and see how we actually doing R&D on the different healthcare problems in Bangladesh and how we actually take into the next level. And we already developed and did some clinical trials of our solutions. And 10th of October, we are launching first breast cancer screening protocol for Bangladesh. And we also doing more. So I would like to invite you all to come to the lab and give your problems for your healthcare industry, and we try to work together to solve the problems rather bringing imported technology. Rather, we can develop technology and export it. Thank you.
Thank you. I think with that, we have reached 6 p.m. So again, thank you for being with us for the first couple of hours. I'm very excited. Thanks once again to USAID. Thanks again to ThinkWell as well, because I think they have been a great partner in putting this together as well. So I'm really excited. Thanks to all of you. Thanks to our honorable panelists. And yeah, look forward with the healthcare sector taking great strides for the Bangladesh market. Mehad, back to you to close the session.
So thank you, Bijon bhai. That was a wonderful session, and I would like to thank everyone who joined today. We heard a lot of insightful conversations from our expert panelists, from the startup ecosystem, the investor group, and the development partners. We heard discussions on how the healthcare sector has improved in Bangladesh through innovative products, services, and business models that are coming up every now and then. We heard how new innovative finances and investment vehicles are actively working in the ecosystem. And lastly, some meaningful recommendations and opportunities to propel this sector forward. So on behalf of LightCastle Partners, I'd like to thank the ThinkWell team and the USAID AUHC team for co-organizing this event. And lastly, thanks to our brilliant panelists for making time to attend virtually and share your knowledge and wisdom with the wonderful audience.